Hello and welcome to our presentation. My name is Dr. Metersky and I will be the lead presenter today. In terms of the background, Indigenous populations continue to experience a disproportionate burden of illness. Particularly in 2015, the Canadian Truth and Reconciliation Commission developed 94 calls to action to rectify the legacy of residential schools and advance the progression of Canadian reconciliation. Based on their response, the Canadian Association of Schools of Nursing began to incorporate more Indigenous health content into nursing curricula, but this incorporation has not been equal across schools on a national basis. When we looked at the literature, no study could be located that explores the implementation of culturally safe care within nursing curricula on the topic of Indigenous health. So the purpose of our study was to analyze student reflections submitted as part of an assignment in an undergraduate nursing theory course to understand how to better prepare students in providing culturally safe care to Indigenous Canadians. In terms of methods, we conducted a qualitative exploratory study of students' reflections that were submitted as part of an undergraduate nursing theory course, where students were asked to critically reflect after watching a video on the Aboriginal People's Television Network about what they viewed during the video and the implications of this content in relation to their evolving nursing practice. Systematic sampling was used where every third reflection was selected and the total sample size equated to 16 participants. Data was collected between December 2022 and January 2023, and the collected reflections were subjected to thematic analysis. TMU, our institutional RAB Research Ethics Board approval, was sought. The results of the study produced two themes. The first theme looked at students' understanding of the experiences of Indigenous populations within the Canadian healthcare system, and three sub-themes resulted. Particularly for our presentation, I will focus on the first sub-theme in the subsequent slide, but you can see the other two sub-themes of lack of access to healthcare services and Indigenous historical trauma also listed for you on the slide. Particularly to substantiate theme 1, looking at sub-theme experiences of racism, discrimination, and stereotyping, 14 students reported on the effects of racialization as Indigenous patients often are instinctively mislabeled by healthcare providers and perceived to be taking part in deviant behavior based on their group identity. You can read some of the comments from students on the slide. This racialization by healthcare providers perpetuated health inequalities as it was described to impede the care provided to Indigenous populations. And the second theme focused on students' perceptions of strategies to be fostered by nursing students to provide culturally safe care to Indigenous populations. These strategies are listed for you as sub-themes on the slide, but for the interest of time, we are going to focus on the sub-theme of advocacy. For advocacy, 7 students reported the value of advocacy skills among healthcare providers to advance Indigenous health. Students described the importance of nurses speaking up for Indigenous people, working to protect Indigenous rights, and improve current healthcare policies to be more accessible and culturally safe. Students described the importance of advocating long-term upstream solutions to improve equitable access to care. A quote from a student can be found on the slide for you. So in terms of implications, nursing education on Indigenous history, knowledge, and culture is imperative to tailor care to be more culturally safe and implement anti-racist interventions to address the inequalities encountered by Indigenous Canadians when accessing the healthcare system. Particularly when we're looking at nursing research, future research should be conducted to evaluate whether a tailored curriculum is valuable in preparing students to practice with cultural humility using a pre- and post-test design. We will point to one strength and one limitation, although we have several for each category. In terms of strength, the study evaluates the effectiveness of an educational intervention from the perspectives of undergraduate nursing students to draw upon strategies to improve the Indigenous health content further in the School of Nursing. In terms of limitations, the study is limited as the analyzed reflections are from one undergraduate second-year nursing theory course taught by one nurse educator in one School of Nursing. So in conclusion, understanding students' learnings is valuable to determine the effectiveness of education provided, and findings can help tailor the nursing curriculum to better address student learning gaps. With the goal to advance Canadian reconciliation, the hope that is tailored nursing curriculum better prepares nursing students to become culturally competent practitioners. You can click on this QR code to access our references. And finally, our contact information can be found on the slide. Thank you.